Hello everyone, I'm Brian Hong from Taipei City Hospital.
Hello everyone, I'm Valis Danabima from Jianxin General Hospital in Taipei.
Today we have some guests from the Singapore and we will discuss about the residency training and
everything else.
Yes, everything. We were so curious about it. And Dr. Steven,
Yes.
Can you introduce yourself?
Yes, hi. Hi, everyone. So I'm Dr. Steven Lim. I'm currently the president of the Society of Emergency Medicine in Singapore. And I'm also a board member of the Asian Society of Emergency Medicine.
Yes,
Thank
welcome,
you for having
welcome.
me.
Hello everyone, I'm Dr. Elizebath Tan. I currently work at Singapore General Hospital. Thank you everyone for having me today.
Okay. Dr. Elizebath, you has just complete your residency and you got the license to be the ER physician. And can you tell us about how is the training program now in Singapore?
Yeah, of course. So I just finished my residency training. It's been about a year already since I exited. So it's actually a really rigorous training program in Singapore because we have junior residency, which is about 3 years, and then we have 2 years of senior residency. So it's a very structured program. We have a very good training with it's called the EMCC, so Emergency Medicine Core Curriculum. So every Wednesday, all the emergency medicine residents in Singapore, they'll have like a 5-hour teaching, and it's combined across the whole of Singapore.
So it's online?
So during COVID time, we didn't have it online, but once COVID was sort of less all those restrictions and all that, then we actually started having face-to-face as well. Yeah, so we have like simulations, so we'll simulate resuscitation. We have pediatrics, we have the pediatric consultants, they'll come down and teach us. And then we have toxicology, it's a whole range of procedures, so it's really, really structured. And the exams and all that, so it's very structured training. Yeah.
So that's a little bit different because in Taiwan, I think we take about 3.5 years span to train an ER physician. But in your country, it's 5 years.
5 years, yes.
Okay.
Yeah.
So, I mean, there is a 1.5 years difference. So, what more? What more you train during your time?
Okay, so we also have exams at the end of it. So there's 5 exams. I'm not sure how is it like in Taiwan as well. So we have like we do MCQs, and then we also have an OSCE. We have OSCE as the mid exam, and then at the end exam it's more of an oral viva as well. And then we also have teaching examinations, so we can learn to be educators, and also have admin examinations where they ask us about overcrowding and how we would deal with it. Let's say if you have juniors that are struggling, all these things, and we have to sort of like prepare for those, which prepares us for the future as well.
Oh,
Yeah.
okay.
I think the interesting thing for their training is that they have projects, like they will participate in quality improvement projects and initiatives. And also they have administrative portfolio. So they do need to participate in like some of the operations of the emergency department. For example, like handling complaints. So that is also an interesting part of the training.
Do you really think it's an interesting part?
I think it's quite valuable because currently in the hospital I work, we get forwarded all the complaints, and you actually understand better, how to help the patients. Because sometimes it's very busy, and you may not think of everything. But when you read all the complaints, I should do better next time. Yeah. So it's important to sort of know, even as you're a resident, what to look out for and all that. Yeah.
So I got on board like I'm very old, over 15 years ago. So back then we didn't actually have much outside the medicine training things,
Like
right?
administration.
Yeah, like a leadership, or the quality care, or the how to face the complaint and how to be more confident and be more like identify that I'm really an emergency physician. That's what I'm proud of. And this is something that's missed back in our training, don't you think?
In the ancient time.
Ancient time. Yeah.
I am curious about one thing is that how you train the leadership, because I found it's very important topic, especially during the international conference. But actually in Taiwan, if you are the chief, you should be the leader. And that's it. We didn't really train our residents.
If you are old enough, we consider that you have experience, and you all said but that's not true.
No.
Yeah, especially when we actually, if we talk with the chief in the, like, let's say, for example, in the US, I feel there's huge difference, especially in the confidence part and how they manage, how they do all their managing. It's all detailed, but not just like us. We are like, okay, I think you can do it. You just do it.
Yeah. I think for the junior doctors, we like to think that we give them more opportunities to lead. So, for example, if let's say they have ideas, they have special interests, the society will definitely encourage them to take it up, and they can take the lead. So, in fact, before this interview, Elizebath shared with me that she's actually passionate about podcasts. And then, I say, okay, then when we go back to Singapore, the society will support her, let her lead, and then, make a podcast.
Yeah, and our key main audience actually is just TSEM.
Yeah.
But okay, of course, the general population, they also can listen, but it's mainly for us because we really have a lot to share. Yeah, especially this time, I feel like we are not alone because even in the US, their emergency doctors are not getting respect as the other expertise. Yeah, not even with the doc in the medical world, but also when faced to the population, they don't consider us a real physician. But here we understand this is all overall problem. So I think during the resident training, the building up the confidence and the leadership is so important.
Yes. I think the technology, like the presence of social media, YouTube, has democratized and given access to everyone. So it is fair, right? We can have our presence on the internet. So, but unfortunately, we are still not savvy at doing that. We are not clever enough to tap it. So I think we should leverage more. What do you think?
Yes, definitely. So it's really inspiring that you guys have this TSEM podcast. So I was really inspired when I saw this.
But during the past few days, we feel like, okay, yeah, everyone is the same. Yeah, and we should be more confident. And we are so bounded, and we have this ICEM that's the best, strongest backup for all the emergency physicians all over the world. That I feel so good. And so
I think it's a fantastic initiative that you invite some participants to come here and share.
Okay.
So this is a good usage of all the thought leadership, and to share that with all your TSEM members. It's wonderful.
Thank you. So thank you so much. Be on board with us, and
I want to congratulate TSEM because I understand this year is your 30th
happy birthday!
anniversary, and happy birthday, TSEM, from Singapore, Sam.
Thank you. Thank you.
It's great to have us. It's great to have us here. We really love it.
And I'm looking forward to your podcast.
Okay.
Thank you very much.
Thank you, Dr. Steven. Thank you, Dr. Elizebath. We wave to the audience. Thank you.